Hello and welcome. Today we're going to delve into neurofibromatosis type 1 or NF1. This genetic disorder affects the nervous system, causing tumors to grow along nerves throughout the body. While it can manifest in a variety of ways, understanding the basics of NF1 is crucial for effective diagnosis, management, and ultimately improving the lives of those affected. NF1 is caused by a mutation in the NF1 gene, located on chromosome 17. This gene provides instructions for making a protein called neurofibromin. Neurofibromin acts as a tumor suppressor, meaning it helps regulate cell growth and prevent cells from dividing too rapidly. The mutation in the NF1 gene either leads to a non-functional neurofibromin protein or reduces its production, allowing cells to grow uncontrollably and form tumors. In about half of all cases, the mutation is inherited from a parent who has NF1. However, the remaining cases result from spontaneous, new mutations in the NF1 gene during conception. At its core, the pathophysiology of NF1 revolves around the loss of functional neurofibromin. Without this protein, the RAS signaling pathway, which is critical for cell growth, proliferation, and differentiation, becomes overactive. This hyperactivity leads to uncontrolled cell growth, resulting in the characteristic tumors seen in NF1. These tumors, called neurofibromas, develop along nerves throughout the body. Additionally, the lack of neurofibromin also impacts other cell types, contributing to other clinical features of the disorder, such as learning disabilities and skeletal abnormalities. NF1 is one of the most common genetic disorders, affecting approximately 1 in 3,000 to 4,000 newborns worldwide. It affects all races and ethnicities equally. Because it is an autosomal dominant disorder, meaning only one copy of the mutated gene is needed for the condition to manifest. Children of a parent with NF1 have a 5% chance of inheriting the disorder. The signs and symptoms of NF1 are highly variable, even among individuals within the same family. Some individuals may have mild symptoms, while others experience more severe complications. Common features include Cafe-au-lait spots, which are flat, light brown birthmarks on the skin, neurofibromas, which are benign tumors that grow on or under the skin, Lisch nodules, which are small benign tumors on the iris of the eye, and bone abnormalities, such as scoliosis or bowing of the legs. Some individuals may also experience learning disabilities, attention deficit hyperactivity disorders at ADHD, seizures, and optic gliomas, which are tumors on the optic nerve. Diagnosis of NF1 is primarily clinical, based on established diagnostic criteria. According to the National Institutes of Health and HI criteria, a person must have at least 2 of the following features to be diagnosed with NF1. 6 or more Cafe-au-lait spots larger than 5 mm in children or 15 mm in adults. 2 or more neurofibromas any type or 1 plexiform neurofibroma, which is a larger, more complex tumor, freckling in the armpits or groin area, optic glioma. 2 or more Lisch nodules, a distinctive bony lesion such as sphenoid dysplasia or thinning of the long bone cortex with or without pseudoarthrosis, or a first-degree relative with NF1. Genetic testing for the F1 gene mutation can be used to confirm the diagnosis, particularly in cases where the clinical criteria are not fully met. While there aren't distinct types of NF1, the severity of the condition and the specific manifestations can vary greatly. Some individuals have primarily skin findings, while others have more significant neurological or skeletal complications. This variability is likely due to a combination of genetic factors, environmental influences, and random chance. Currently, there is no cure for NF1. Treatment focuses on managing the symptoms and complications of the disorder. This often involves a multidisciplinary approach, including neurologists, dermatologists, ophthalmologists, orthopedic surgeons, and other specialists. Specific treatments may include surgery to remove neurofibromas causing pain or disfigurement, chemotherapy or radiation therapy for optic gliomas or other cancerous tumors, medications to manage pain or seizures, and physical therapy to address bone abnormalities or motor skill deficits. Regular monitoring and surveillance are also crucial to detect and manage potential complications early. Since NF1 is a genetic disorder caused by mutations, it is currently not preventable. However, genetic counseling is recommended for individuals with NF1 or a family history of the disorder. Genetic counseling can provide information about the risks of passing the condition on to future generations and discuss available reproductive options, such as preimplantation genetic diagnosis, a PGD. The prognosis for individuals with NF1 is variable. Most individuals with NF1 have a normal lifespan. However, the condition can lead to significant morbidity due to complications such as tumors, pain, skeletal abnormalities, learning disabilities, and an increased risk of certain cancers. Recent research has focused on developing new therapies that target the underlying molecular mechanisms of NF1. For instance, MEMIK inhibitors have shown promise in shrinking plexiform neurofibromas in some patients. Ongoing research is also exploring new diagnostic tools, such as improved imaging techniques and investigating the role of the immune system in NF1. Ultimately, the goal is to develop more effective treatments that can improve the long-term outcomes and quality of life for individuals with NF1. Thank you for watching.